Bismillahirrahmanirrahim. So, inshallah, in a few seconds, we will start our long clinical consultation. Our active participant is here. Just give me a few seconds so that I can share the picture of the patient, and then I will set the timer, and then I will prompt you when your time starts. You will get total 15 minutes, and when 2 minutes are left, I will prompt you again, and then we will have a viva of 5 minutes. Okay? Okay, so doctor, are you able to see this picture?
Yes, doctor.
Okay, so your time starts now.
Okay. Hello there. This is can I see the scenario again? Okay. Okay. Hello there. This is Dr. Rashid, one of the doctors in the clinic today. May I confirm your name and age? You're Mr. Ali, who's 55 years of age.
Yes, doctor, actually, I am sister of Mr. Ali.
Okay. Can you confirm your name for me?
Yes, you can call me Miss Alina.
Miss Alina. Okay, Miss Alina, you are the sister. You are sister of Mr. Ali, who's 55 years of age.
Yes,
Miss Alina, I'm here to talk to you regarding your health condition and would be examining you. Is that okay?
okay.
I will be writing down some notes. Please be assured that they'll stay confidential. Can you please tell me what has brought you here in the clinic? What is going on with Mr. Ali, and why is he admitted over here?
Yes, doctor, actually, my brother has been suffering from hearing loss, and it is there for the last 1 month. And we all are quite worried, so that's why we are here today.
I can certainly understand your worries, Miss Alina. I'll try my best to sort this out for your brother. Previous to this last 1 month, has your brother been completely all right, or has there been any problem ongoing?
Yes, doctor, he has some problem ongoing throughout his life for many years. Previously, he has undergone some fracture of his left leg, and he has been treated for that.
Previously, how long back?
It was almost 6 months ago.
All right. Oh, I'm very sorry for that. Okay. And has he been admitted in the hospital, and is he taking any ongoing any surgery or medication for that?
Yes, doctor, 6 months ago, he undergone a hospitalization, and at that time, yes, he undergone the surgery.
Okay, all right. So, Miss Alina, has your brother like ever experienced any problems previously, like any bony problems, like any large head, or any or the fractures has been ongoing a problem for him for his life?
Yes, doctor, you are right. He has bone pains. He has widespread bone pains throughout his life. I mean, we don't remember exactly when it started. But regarding the fractures, this was the first time that he encountered the fracture 6 months ago.
All right, okay. And have you noticed any increase skull, any head circumference for him, or
Yes, doctor, his appearance has changed in the last few
appearance?
years.
All right, okay. Has he been any time losing or gaining weight?
No,
Okay. Any lumps or bumps anywhere?
no,
Any rashes on the body?
no,
Any, have you noticed that has he gone paler, or has he the skin tone has been down or pale?
no.
Okay. Do you have you ever noticed that he has gone dizzy while standing up from a sitting position?
No,
Anytime, any loss of consciousness?
no,
Okay. Any problem with the with the joint pains or muscle pains?
Yes, doctor. Overall, he always complains that he has pain everywhere. Sometimes he complains that he has pain in the arms, in the legs, as well as in the back.
In the back. Okay. Any deformity have you ever noticed in his back also?
Yes, doctor.
Okay. Uh, okay. Any changes in his waterworks recently or in the
No,
past?
no,
Any changes in the loose or tight motions?
no,
Okay. Any tummy pains ever?
no,
Any chest pains?
no.
Any breathlessness has he ever encountered?
Yes, doctor. He encounters this breathlessness.
Breathlessness. Like how? Does he often get breathless when he lies down or he walks?
Yes, at lying down position as well, and during exertion as well, especially on climbing the stairs.
Oh, all right. So how long can he walk before he gets breathless?
At
Especially
ground level,
how
doctor,
can
yes,
yeah,
at ground level he can walk, but whenever he has to take some flight of stairs, then he get
mm,
breathless.
flight of stairs, and how it is different from his previously routine?
Previously, no, doctor, we haven't noticed that he suffers from this problem of
Previously
breathlessness.
never. So well, it has been going on recently.
Yes, since last few
Okay.
months, 6 months.
6 months. Okay. Has he increased the number of pillows recently?
Yes.
Okay. And has he ever told you like he has the swollen ankles?
Yes, doctor, once a time it was there, but it is not now.
Not now. Okay. And has he ever got up in the middle of the night for gasping of air? Hmm.
No.
All right. Has he ever tell you that he has been coughy or coughing out sputum, phlegm or blood?
No.
Okay. Has any problem with his hearing?
Yes, doctor, he has presented now with a hearing loss actually since last 1 month, which is bothering us more.
Hmm. Suddenly, and he was previously all right, and there were no problem with his hearing, right?
Yes, there was previously no problem in hearing.
Hmm. Okay. Any problem with his eye changes, like any problem in his vision?
No.
No vision problem. Any headaches?
Yes, doctor, he complains of headache.
Okay. Has he so okay, no problem in the vision, right? Okay, all right. Then any past medical history you have told me about. So any past medical history of high raised body sugars, raised body uh, blood pressure?
No.
Mm-hmm. Okay. Any medicine he's on
Yes, doctor, on and off he takes paracetamol and some painkillers for his pains.
for his pains? Okay. And how often does he have to take those paracetamols?
Almost daily.
Almost daily. Okay. So how much in a day he takes? How many tablets?
Sometimes it is only one, sometimes it is two, maximum two.
Maximum two. Okay. So can you tell me more about his headache? Like, what is the nature of his headache?
Doctor, it is dull, diffuse, and not present all the time. But whenever there is some sort of, you can say, flare up that he complains of pain all over his body, then he says that yes, there is pain in the head as well.
Pain in the head as well. Recently, any raised body temperature episode?
No,
Any sore throat? Any uh, chesty person encounter?
no.
Okay. Okay. Then any family history of note? Any family history of similar problems?
Yes, doctor, actually, our father suffered from brain tumor, and the doctor diagnosed him with acromegaly. But at that time, he undergone surgery, and he is doing well now.
You're doing well now. Sorry for that, Miss Alina. Okay, and this headache is overall and dull and diffuse. Can you tell me that what would you or Mr. Like Ali has to like grade it on a scale of 1 to 10?
It is 3 to 4, doctor.
3 to 4. Okay, and it doesn't radiate to anywhere.
Yes,
It doesn't. It does not. Okay.
yes, it does
Any
not.
It does not. Okay. Okay. I will ask you some more questions. Then I will be examining you. Do you smoke, Miss Alina? Does he smoke?
No,
And does he take alcohol?
no.
And what does he do for his living?
He is a driver.
And how it has affected his work and his chores in life, his household
Yes,
work?
doctor, it is affecting a lot. I mean, previously, yes, it was affecting him, but since last 6 months when he undergone the fracture and since 1 month of hearing loss, he is almost unable to resume his job.
Yes, I can understand. I'll come back to that in a moment, Miss Alina. I wonder that he has to inform the DVLA about his condition since he cannot hear well. So until they will assess your brother and they will be in a better position to tell that how his driving can be proceeded further. Whereas we can involve a certain occupational health department if he needs any changing of the his occupation or something like that. Right now, he will be probably taking some rest after that leg fracture. So, can I will now start to examine your brother.
Okay,
So, will I take permission from Mr. For this, or will I just
yes,
proceed?
you will take the permission.
Okay, so I'm going to examine you.
Hmm.
If there is any pain, please do let me know.
Okay.
So, is it okay for you?
Yes. Okay, doctor, you
Do
will
you have
tell me the steps and I will tell you the findings.
okay? So, do you have any pain right now in the left leg?
Yes, doctor, I have some pain.
Okay, you have pain. Okay, I will try to be gentle over there, and then I will start off with the patient's hand. Can you please
Hmm.
just show me, extend your hands for any clubbing, any palmar erythema from the hand? I will check the pulse and I will try to
Hmm.
check the tachycardia, no, the volume of the pulse, and also I would like to check the radial, like bilateral pulses.
Hmm. Okay,
Okay,
all
then
normal.
all normal. Do you have any pain or tingling sensations anywhere, Mr. I'm sorry, I'm forgetting the name, Mr. Ali. Do you have any
Uh,
pain or
yes, numbness is there in the hands.
numbnesses, and which area
In the hands,
in the
palms,
hand, or overall hands, or just the lateral or medial sides?
overall.
Overall numbness. Okay. Okay, then I will just try to take a neurotip and will now start performing the sensory examination, that this is going to be this sharp at your sternum. Please do let me know where and how is this are you feeling same on both sides? So I will be checking
Yes,
sensations, how it they are affected, like dermatomal pattern and then gloves pattern.
same, no change.
Same, no change. Okay. Then I will offer the blood pressure here, and I will also take a look of the back of the patient, and I will be asking that do you have any pains if I touch here, just to see what type of abnormality is that. That's a kyphoscoliosis or a it's a kyphoscoliosis, I think so. Okay, so yes, I can see that. Okay, now I will just quickly listen to the crepitation, bibasilar crepitations for any signs of heart failure. Then I will ask the
Yes.
patient to, I will come forward and I will
Hmm.
quickly take the visual acuity. If there are any problems in the eyes, I will
Hmm.
offer the Weber's and Rennie's test,
Hmm.
and I will just quickly look that there's a head size is changed, and there's an increased head size. And I'm also expecting, I will offer the fundoscopy for any angioid streaks.
Hmm.
Then I will ask the patient to, I will also palpate the apex beat, I will
Hmm.
listen to the murmurs.
Hmm.
Uh, okay. Then,
2 2 minutes are left.
okay, all right. So what are your concerns for me, Miss? Uh, what are your
Yes,
concerns?
doctor. Yes, doctor. I want to know that what's going on with my brother.
It seems to me, Miss Alina, that your brother is having a problem that we call as Paget's disease.
Hmm.
However, I have to be sure for being sure, I have to admit your brother for to run some tests that will include the bloods and images.
Hmm.
And after then, I'm going to formulate a team of doctors, and we will discuss this thing and how the things will be going forward. For that, I have to arrange another meeting, and we'll be discussing the further management plan for your brother. Is it okay for you?
Yes, doctor. And will you admit my brother today?
Today, like, yes, for a short time period, because your brother has this some abnormal some like for just for the time being, to confirm the diagnosis, and we have to admit your brother. But later on, it's an ongoing problem, and we will your brother has to be, closely follow up by the specialized team, then, and he has to follow up for the specialized with the specialist and with the specialist clinic. Are you getting me?
Yes, doctor.
For the time being, I can also offer your brother any painkiller if he's right now having any pain. And I would be happy if you have any other concerns for me right now.
Yes, doctor. Is it totally curable condition?
I appreciate your worries. However, I'm very sorry to tell you that it's an ongoing condition. We can manage the complications of the disease by, regularly following up and being compliant with the medications. But I'm very sorry, Miss Alina, these conditions can't be reversible.
Time is over.
Thank you.
Okay, coming towards the viva. Tell me your positive findings in the history.
So, Mr. Ali presented with the bone pain. So, in the last 6 months, he just got his left leg fracture and has been having some problem in difficulty in hearing from the last 1 month. Apart from that, he was also having some headaches, which has been ongoing here and there, and also some joint pains and bony pains. Apart from that, he was not losing any weight or any. There was no any significant history apart from some like exertion, shortness of breath and breathlessness on walking. And from the last 1 month, it has been going on, and he has also problem in exerting himself. On examination, there was I could clearly see that there was some bony deformities in terms of kyphoscoliosis, head circumference increased with the deafness, with the patient had probably some hearing aid in his ear, or apart from that, I could not appreciate any other positive history from the patient.
Hmm. So, what are your differentials in this case and your provisional diagnosis?
So, considering all these positive findings, in view of these findings, I would like to put Page's disease as my professional diagnosis. And apart from that, I can put osteoporosis.
Hmm.
I can put cardio as he has been having some problem with the cardio like mm, any bony and cardiac problems. So apart from osteoporosis, then I'm sorry. There are just two differentials I'm having right now in my head.
Okay, how will you investigate this patient?
Okay, for to confirm the diagnosis, I will do um, the X-ray left leg, left femur, and I would like to
Hmm.
do the whole bone scan for this patient. And to just to I'm expecting some peculiar changes in the X-ray of the head. Then I would be
Hmm.
doing serum alkaline phosphatase,
Hmm.
then calcium, phosphate, vitamin D levels.
Hmm.
Apart from that, I would also be doing some normal blood, for example, complete blood count because I'm expecting some anemia of chronic disorder, ESR, CRP for any infective inflammation and infection going on, liver function test and liver function test, urea electrolytes, and so use and ease can be done as a part of basic blood investigations. And also there is one, I think so, serum or urine. I think there is some levels of urine and serum, very particular.
Any investigation for hearing loss?
Yes, audiometry can be done, and he can be sent to the specialist clinic for that, for have a proper assessment of the this Webers and Rennies and audiometry. So
And
he
how
should
will
be
you
referred to
treat?
there.
How will you treat this
So
patient?
it will be a patient education and counseling about the condition and about the with the caretakers of the patient. It will be a physiotherapy, occupational therapy support along with the social service. Then patient will be at it's an ongoing condition. We will involve um, the brain, the rheumatol, the I think.
Hello.
It will be we can give some uh, like calcium, vitamin D supplements, and in the long run, with the help of seniors' advice, we can also start him on bisphosphonates.
Okay. Time is almost over. Okay, doctor. Overall, it is not a bad performance. I mean, you come towards the diagnosis, which is the actual diagnosis over here. But few things which I want to mention here. So let's start this thing again. Like when you are outside, you get the scenario. You will be given a paper, which will be given, which will you will take this paper inside the exam hall, so that you have to write the important points of history, so that you can narrate to the examiner in a better way. Okay. So first of all, when you got a long clinical consultation scenario, first of all on the paper you will write the name and age of the patient, so that yes, we all can forget, so that we whenever we forget, we look at the paper, and then we can come to know the name and age of the patient again and again. Okay. And other thing which you should know, that for example, whether you have to take the history from the patient or from the relative, and in case it is from the relative or the surrogate, what is the relation, or in case for example they might have given you the name of the relative, so write that down on your paper as well. After that, you will read the scenario. Most of the time in PACES, they give you only one or two presenting complaints. So you write the presenting complaint as well, and think about the presenting complaint. And in case if there is any other clue, like here, they give you a clue in the past history, as well as sometimes they give you a clue in the vitals, or sometimes in the lab investigations. So correlate them in your mind when you are outside reading the scenario, and make some differentials, so that inside you can ask the questions of those differentials. Okay. So this thing is basically which is wanted from you in basis exam. And like in this case, you have to take the history from the surrogate, so it will not be possible that you talk with the patient, and whenever the bell ring, you go inside the room. So just it is a tip that you look at the patient from head to toe, and in case if there is any spot diagnosis, or there is some clue in the exposed areas, like on the face of the patient, on the hands of the patient, or any other clue in the surroundings, you can have a better look in the initial few seconds when you are settling down with the surrogate to take the history, because it might be the possibility that you have the back towards the patient, so you cannot look at the patient again and again during your history taking. Okay, one thing this, and another thing is that you should complete the history in 7 or maximum 8 minutes, or till 9 minutes, because always give time for examination. Physical examination, identifying physical sign, it is a very important skill in PACES exam, and it will only be possible that you find out the physical sign if you give a good 5 or 6 minutes. 6 minutes should be spared for the examination. So ideally, it should be 6 or 7 minutes history, 6 minutes examination, and then 2 or 3 minutes for the concerns. Because concern itself is a very important skill which needs to be passed in a PCS exam. So here you get the presenting complaint of hearing loss. And inside you go, you ask from the sister that what brought your brother to the clinic today. Okay, yes, right from the start, you go inside, you greet the examiner, then you will greet the patient or the surrogate, for example, here. And then you will introduce yourself. You will check the identity of the patient yourself and check the identity of the surrogate. And for example, you can ask how I can address you. Like she said, you can call me Miss Alina. I am the sister of Mr. Ali. And you can confirm the name, age of the patient as well. After that, yes, you will set the agenda that I have been asked to take your brother's medical history. I will do his examination and I will answer all of your concerns. Is that okay with you? Meanwhile, I may write few notes, but let me tell you, they will be kept confidential. By saying this, your marks for the maintaining patient welfare will be counted. So this is very important thing that you set the agenda, you maintain the confidentiality, and then you will start taking the history. So in the history, first you will give the open-ended question to the patient or the surrogate that what brought your brother to the clinic today. Okay, she told you that my brother has been suffering from some hearing loss for the last 1 month. One thing I would suggest that whatever your case is, I mean, do not jump towards the diagnosis. Just have a sequenced approach, because most of the time, in case if you didn't find the diagnosis till history, you will get some clues in the examination. And in case if you are not able to come up with the diagnosis even at the end of your 15 minutes consultation, still the examiners will see that how you approach this case. Have you completed all the steps in a sequenced manner? Have you done all the examination steps in a sequenced manner? And let me tell you, they will help you in finding out the diagnosis or in reaching the diagnosis during your viva. So this is the thing that you follow the scheme. Like for example, here the presenting complaint is hearing loss. So first complete the OD para of hearing loss, complete evaluation of this hearing loss. Like for example, you will instead of asking anything in the past history, they have given you the clue that he has some fracture of the left femur. Just complete the Odipara of hearing loss here, like how it started, gradually or suddenly. Give the options to the patient, because sometimes the surrogate do not know how to answer this question, that how it started. So you will give the clue, give the option that does it start gradually or suddenly. After that, yes, she told you the duration, that it is 1 month. In case if they don't tell you the duration, you can ask here that okay, it started 1 month ago. Is it for the first time or it occurred before as well? Is it getting worse or it is the same like when it started? Okay, so this you will assess that whether it is progressive or not. Anything which makes it better, anything which makes it worse. Aggravating, relieving factors. Whatever your presenting complaint is, you will complete the ODPARA, onset, duration, progression, aggravating factors, and relieving factors, and associations. Like, for example, again, here you will give the open-ended question to the patient. Any other symptom associated with this hearing loss? It might be the possibility that they will tell you, or otherwise, for example, if the examiners have told them to do not tell anything to the candidate unless and until he will ask. So here you will first localize the system. I mean, till here you are not sure that which system you are running with. It is not a cardiovascular system, it is not somewhat like a gastrointestinal system or like pulmonary system. So just for example, local thing you will ask here, there is hearing loss, so you will ask the question like tinnitus, for example, any sounds in the ear, excessive noise in the ear along with this hearing loss. Okay, he told you nothing like that. In case, for example, till your Odipara, you are not sure that which system you are running with. Either it is nervous system or it is a general system, it is a multi-system. So the best thing here is that you move towards the general constitutional symptoms. Like, for example, here you will ask any fever, like increase body temperature. Fever is considered a jargon by some of the examiners. So increase body temperature, he will tell you either it is there or it is not. Like in this condition, most probably it will not be there. Then you will ask about fatigue. Fatigue, lethargy, malaise, increased feeling of tiredness. Mostly they are there with this condition of Paget's disease. Okay, one thing more, for example, whatever your positive things the patient or surrogate will tell you, you will stop there explore that thing and then move forward. Like for example, he will tell you, yes, I have my brother has feeling of fatigue or lethargy. So explore it. For example, is it there all the time, or it is there at specific timings, like in the morning or in the evening, so that you can explore the fatigue more and then move forward. Like any night sweats, any weight changes, any increase or decrease in your appetite, any skin rash, any joint pains. And in the joint pains, you can ask the question like bone pains. And when the surrogate told you like bone pains anywhere in the body, ask for example specifically which joints are involved or which areas he feels the pain. Like for example, here he says it is widespread involvement, like arms, legs. Here explore these pains like backache, headache. Yes, you asked about that all, na? After that, yes, you can ask about other conditions. When you are asking about the skin rash or joint pain, here you can ask about lumps and bumps. Yes, you asked about that, or about the weather preference, or pins and needle in the hand. Yes, you ask that question. Okay, one thing here, for example, if you are examining the patient and you have taken the history from the surrogate, so it will not be possible that you can do the examination side by side and take history side by side. It will be difficult. However, if you have to take the history from the patient in the same English language patient understands, then it is okay that you can ask the questions during your examination. But in this case, like surrogate is giving the history and you are doing the examination of the patient, actual patient, so it will not be possible. Just keep those questions in the mind, and when you come back to the surrogate, you can ask the questions from the surrogate at that time. Okay. So after that, yes, you asked about the pins and needles, you ask about the chest pain, and you explored the shortness of breath in a quite good manner. And ankle swelling as well, orthopnea was there, paroxysmal nocturnal dyspnea was not there, but it was somewhat clue that it might be a case of heart failure as well, in as a complication of this disease. And after that, like for example, yes, you asked about the headache, about the loss of consciousness and all those things. Then moving towards the past history, any previous hospitalization? Yes, you asked any specific surgery done in the past. It was only this condition, that is the fracture. Allergic history, I think you didn't ask. But medication history, yes, you asked about it. Family history, or for example, in the social history, I don't think so that you asked about the illicit drugs, although not relevant with your case, but still it is the part of the history. So illicit drugs, recreational drugs, and one thing more, whenever you are going to ask the social history, first you give the warning sign to the patient or to the surrogate that now I want to ask certain personal questions regarding you or your brother. But let me tell you that they will be kept confidential. So after that, yes, you will ask about has your brother smoked? Or does he drink alcohol? Any use of recreational drugs or party drugs? And what does he do for living? And what is the impact of his symptoms on his occupation, as well as regarding any significant travel history before the onset of this condition. And after that, yes, you started the examination. First of all, you will do the inspection, and after that, you will move towards the hands on the right side, and you will do the this general physical examination. Okay, one thing more, when you are doing the pulse, collapsing pulse can be associated with Paget's disease. So this you can also check apart from radial delay. And one thing more, that you were asking about the visual symptoms, like you were differentiating it from some acromegaly. You can ask the questions of acromegaly in case if you are not sure about the diagnosis in your history. You can ask about like any blurring of vision, any bumping into the objects, or any difficulty in seeing in the side objects, and likewise any changes in the size of hands and feet, or any excessive sweating. And meanwhile, in your examination, you will not only pay focus on the Paget's disease, but also your differentials. Like, for example, is there any increased sweating in the palms, or any enveloping handshake, any doing hands, or for example, any increase in the size of hands or feet? And likewise, you can check for the proximal myopathy here, in case if you are not sure that it might be a case of acromegaly. So after that, yes, in the eyes, you will look for anemia, you will look for pallor, conjunctival pallor, as well as BL field in case if there is any bitemporal heminopia, and all those things, like for example, blood pressure you can't check, or fundoscopy you can't check. You can offer this before the start of your viva. Okay, and after that, like you will even in the mouth examination, you can look for the tongue size or interdental space or malocclusion of the teeth. And in the back examination, when you were looking for kyphosis or scoliosis, you can look for acanthosis nigricans. And yes, you will look for sacral edema, as well as you will auscultate the basis of lungs for fine and inspiratory crepitations, which can't change their character on cuffing. Mostly in these patients of Paget's disease, they have the complication in the form of cardiology complication can be high output cardiac failure. So it might not be the thing that you can find any murmur over there in the precordium. But yes, in case if you have time, you can auscultate the precordium, you can localize the apex beat. And regarding the leg examination, you should pay focus on the bowing of bones or any bony deformities, okay, and any bony enlargement as well. Or for example, here there was in the history that patient has undergone left femur fracture and undergone surgery. So here you can look for the scar for the pathological fractures. Okay. And these are the things basically in the examination. You can look for raised venous pressures for the cardiac failure as well as fitting pedal edema. And after that, yes, in the concerns, okay, one thing here that always try to answer the concerns in shortest and crisp way, because it might be the possibility that patient has more concerns, more than 3 or 4 concerns. So keep on asking the concerns unless and until the surrogate will tell you that no more concerns. Okay, so this thing is there in the history and consultation, examination, and concerns. And then when you the bell ring, you are coming towards the examiner for the viva. Here, before the start of your viva, you will offer those things in the examination, for example, which you have to do. Like for example, here you will say, in order to complete my examination, I would like to check the fundoscopy for any angioid streaks and check the blood pressure of this patient. And likewise, here you will examine the cranial nerve, eighth cranial nerve. And that is basically the thing that just in the rough manner you will do the examination, that ask the patient to occlude one ear, and just rough test you will say that are you able to hear, and likewise on the other ear you will also do like this. So this in this manner you will check the eighth cranial nerve, and the Weber test and Rinne's test you can offer to the examiner. And after that, in the history, you will tell all the positive findings, not only in your history of presenting illness, also in the past history, medication history, family history, as well as social history. And likewise, in the examination, you will tell all the findings. And here, yes, the first top most differential, which is favoring, I mean, history as well as examination, it is the Paget's disease of bone. And you can keep osteoporosis, osteomalacia, and acromegaly as well. And you can justify these things that since the patient does not have any increase in the size of hands and feet, or like any no blurring of vision or bumping into the objects, that's why I'm keeping this differential down the list. So this in this manner you will tell the differential diagnosis. And in the investigations, yes, you are right. X-rays you will look for, uh, and in the findings also tell the findings whatever you will tell in the investigations. Like in the X-ray you will look for cortical thickening, sclerosis, and osteolysis. In the bone scan you can look for hotspots or increased uptake on the bone scan. Even you can go for skeletal survey, or like for example MRI brain as well for the compression of internal artery meatus. And likewise in the blood investigations, a complete blood count looking for anemia, inflammatory markers, ESR, C-reactive protein, as well as serum calcium, phosphate. Serum calcium and phosphate will be normal. However, alkaline phosphatase will be raised in this case. Okay, I give you the clue. In alkaline phosphatase normal, it can be normal, it can be raised. Patient might be taking medications, so they can give you some clues just to confuse the case. And one thing more, for example, whatever the case is, outside you get the scenario, you will confirm each and every finding inside, like the symptoms. It might be the thing that, for example, here it is written outside patient has presented with hearing loss. Inside, you will confirm it yourself that what brought your brother to the clinic today. So this thing you will recheck inside as well regarding the symptoms and all those things here. And other things is that in the investigations, um urinary markers, hydroxyproline, telopeptide, they can be raised. And urinary calcium as well, serum uric acid as well. Urinary calcium, most probably it will be normal, and uric acid can be raised. And regarding the hearing loss, yes, you're right. You will go for audiometry, as well as you will refer the patient to the ENT specialist who will do further evaluation for either it can be conducting hearing loss, as well as it can be sensory neural hearing loss. It can be mixed hearing loss. So these are the things. Even you can go for bone biopsy to evaluate for any malignant transformation. Okay, and even serum acid phosphatase levels as well. There can be secondary hyperparathyroidism in case of Paget's disease. And in the treatment, regarding starting from the general treatment, then the specific treatment. General treatment always start from patient education, counseling, and education about the disease, and counseling of the relatives as well. And orthotic devices, any walking aids, hearing aids, multidisciplinary team involvement, involvement of orthopedic surgeon for any kind of fracture, dislocation, or bony deformities, neurosurgeon involvement for any kind of complications of the spine, ENT involvement for hearing loss, for tinnitus, for hearing aid, rheumatologist for joint pains, eye specialist for enjoyed retinal streaks, oncologist in case if there is any malignant transformation, osteosarcoma, or cardiologist involvement, as this patient can have high output cardiac failure, as well as physical medicine, rehabilitation medicine. They have a role in this condition, and pain management, basically, that is analgesics and NSAIDs therapy. And after consultation with the multidisciplinary team, patient will be started on bisphosphonate therapy with serial monitoring of the bone markers, calcium as well as vitamin D levels, and advise the patient for avoiding any trauma and avoidance of any contact sports. So this is all about in the treatment. Now I will look for the messages in the chat. Yes, alkaline phosphatase is increased in Paget's disease. It might be the case that patient here is taking the treatment because this hearing loss will develop in Paget's disease when the patient will develop the complications. So it will they might confuse you by this thing. So each and everything might not be the case that actually related to the case. They can give you such clues. Actually, alkaline phosphatase is increased in this condition. Calcium and phosphatase are normal. Serum uric acid can be increased. Gout is common in this case. Yes, you are right. And other things are that, for example, for example, you have come up with the diagnosis. You can also ask the questions in the complications. Like here, the complication can be in the form of congestive cardiac failure that you already asked. Entrapment neuropathy, like for example, you were asking about pins and needles in the hands or feet, or like it can be some visual changes, optic atrophy, or angioid streaks. Angioid streaks can be in Paget's disease, it can be in pseudoxanthoma elasticum, it can be in Ehlers-Danlos syndrome. And other complications of Paget's disease can be in the form of malignant transformation of this condition, like osteogenic sarcoma, or even these patients can have spinal cord compression. I mean, these can present like this. Cauda equina syndrome is a complication, although rare, but it can be there. And likewise, these patients can have hyperuricemia, they can have nephrolithiasis, kidney stones. So this is all about which you will look for in the case. Any questions? Other differentials can be in the form of osteomalacia, it can be in the form of osteoporosis, and it can also be in the form of acromegaly. Although this patient does not have any kind of change in the size of hands or feet, or like any kind of real problems. But in case, for example, they give you a case like angioid streaks are there, or there is any cranial optic nerve compression, so it can be the things. What about bone scan? Yes, bone scan, CP angle tumor. Basically, in CP angle tumor, most of the time they will give you a hearing loss can be there. Like it can five nerve involvement, six nerve involvement, seventh nerve involvement, eighth nerve involvement can be there apart from cerebellar signs. So that is something like different case. Patient will not have bone pain, or patient will not have anything like in this condition like kyphosis, or like for example bowing of the bones, or any change in the size of skull. Most of the time this patient will present with headache, and in that case, for example, you will explore the headache. There can be red flags in the headache, and in examination you will look for all the cranial nerves. In the form of trigeminal nerve, there can be sensory loss in the distribution of trigeminal nerve. There will be facial nerve involvement, there will be abducent nerve involvement, as well as this hearing loss. And as well as the patient can have nystagmus, patient can have cerebellar signs. They will tell you that they have difficulty in walking, or there will be difficulty in balance. So that is basically a different case. Secondary hyperparathyroidism, I said. Secondary hyperparathyroidism. Bone scan, yes, bone scan, basically it is the diagnostic investigation. Patient can have hot spots. There can be increased uptake of these lesions in the bone scan. Management, I told that always start the management from the general management. Always patient education, counseling, explanation of the condition, explanation of the disease to the relatives, and then there will be some hearing aids that you can give to the patient, or somewhat like you will advise the patient to avoid any kind of trauma which can lead to pathological fracture, advise the patient to avoid any contact sports, and multidisciplinary team involvement, orthopedic surgeon, neurosurgeon, ENT specialist, eye specialist, rheumatologist, cardiovascular, cardiac surgeon, this is a cardiologist, oncologist, as well as physical medicine and rehabilitation and pain management, analgesics, bisphosphonate therapy after consultation with the multidisciplinary team, and serial monitoring of these bone markers, calcium, as well as phosphate and alkaline phosphatase. Any other question? Okay, so if there is no question, so thank you so much for joining. Stay blessed. Allah Hafiz.